Today, at the proffer paper session of ESMO GI 2026, we saw the data of two clinical trials directed to the treatment of HCC hepatocellular carcinoma. Those trials are the EMERALD-3 trial and the EMERALD-1 trial. So let's talk about the EMERALD-3 trial. This was a phase 3 clinical trial in which patients with embolization-eligible HCC could be randomized to a stride regimen plus Lenvatinib plus TACE, or stride regimen plus TACE, or again randomized to the standard TACE alone. What was previously demonstrated at ASCO 2026 was an advantage in terms of progression-free survival for both the experimental treatments. What we saw today was an update in terms of progression-free survival evaluated by the RECIST criteria 1.1 by BICR, so a central review, and using also the modified RECIST criteria. Again, we had a confirmation that progression-free survival was in favor of the two experimental treatments, but overall survival data are still pending. Then we had the data on EMERALD-1 trial, which is an older phase 3 clinical trial in which the same population of embolization-eligible patients was randomized either to receive the Durvalumab, Bevacizumab, and TACE, or to receive Durvalumab and TACE, or TACE alone. We had previous data which were presented with a positive progression-free survival for the arm including Bevacizumab. At this time, overall survival data were presented. Unfortunately, overall survival data were negative, posing some question about the use of progression-free survival as a surrogate endpoint for overall survival. All in all, those results probably are still pending of overall survival confirmation, but still stride plus or minus Lenvatinib could be a good option to be added to TACE, especially in patients with an intermediate risk HCC.